Hi, everyone, and welcome to Chai Side Chat Season 2. This is an exclusive interdisciplinary talk show featuring interviews with folks about creativity, the arts, healing, personal growth, spirituality, identity, mental and emotional well-being, among many other things. I am your host, Aishwarya Subramanian, and for today's episode of Chai Side Chats, we are going to be digging a little deeper into the intersections between physical, mental, and emotional healing and recovery. So both of my guests for today are physical therapists who have treated patients with a variety of issues, including chronic pain, pelvic health, and general orthopedics. They're both also trained dancers who've worked with artists, athletes, and performers around healing, recovery, and injury prevention. They may live and practice on opposite coasts of the US, but I have a feeling that they'll be on the same page when it comes to chatting about all things related to physical and mental well-being and recovery. Please welcome Dr. Divya Raghavan and Dr. Sneha Gazi. Hi, ladies. Thank you so much for being here and welcome to Chai Side Chats.
Hi, so excited to be here with you.
Great.
Hello, everyone.
So diving right in, my first question for both of you as physical therapists, what are some of the most common injuries that you're seeing or treating people for these days, especially since the pandemic started? I think a lot of people have been working from home, so I imagine that there's unique challenges that have come up for patients in that process too.
Sure, I can go first. So this is interesting because, you know, my practice is located in the Silicon Valley. So most patients I treat are corporate professionals who are also dancers, right? So what I see since the work from home situation started, a lot of people are having more of neck pain and low back pain because people are trying to kind of get the ergonomics right using their home furniture, which sometimes doesn't always work. And then if you're talking about artists and performers, they have to quickly transition from a sedentary desk job to then doing movement-based activities. And sometimes that right warm up, if that's not there, then we're seeing a lot of like strains of muscles, like especially for classical Indian dancers, the strain on the knee is a lot. So if they're not stretching their hip properly or their core has not been activated the beginning of the day and they try to do that. So if it's mostly related to work from home, I'm seeing mostly spinal issues. And then for performers, I'm seeing a lot of hip and knee pain.
Yeah, I would echo a lot of those same kinds of themes. I would say definitely at the start of the pandemic, full-blown ergonomic problems, people with back, neck pain, wrist pain. I got very familiar with a lot of the brands out there who sell a lot of chairs and desks and, adjustable standing desks and things like that. But because I practice in New York City and my practice is in-home, it's an in-home service. So I actually only treat people in their home environments, which is really cool because I actually got to see them in their environment and then make the adjustments during the sessions. And sometimes it would be very simple as like, put a shoebox under your feet or, just move closer to your desk and move your computer a little bit further or lift the monitor up. Or sometimes it would be very simple adjustments. And then sometimes it was like really bad where people just needed their whole situation needed to be changed, where people I found were like working on their beds or their couches or, just places where your body is just not aligned in a really good way to sustain, 8+ hours of working. And then the other trend is because of the pandemic, a lot of people were working longer hours because they're at home. And so their bosses just expected them to work this extra time. So I definitely saw that was one of the big trends. And then because I specifically treat the pelvic health population in New York City, amongst other things in orthopedics, I see a lot of people who are pregnant or new moms. And so what happened was people, especially at the thick of the pandemic, people were not comfortable with getting their nannies inside their houses. So a lot of parents were cooking, cleaning, taking care of their kids, doing homeschool. And it was just a lot on their bodies that they otherwise weren't used to. So that was an issue for at least from that general population. And then if you're talking about the dancer population, I mean, right now, Broadway just opened up in New York City, and I was backstage treating a couple of shows, and everybody's issue was, sure, you're conditioning and training, but there's only so much that you can do outside of actually when you're preparing and doing rehearsals. So a lot of people are out of shape, or, there was a lot of talk in the, Broadway industry and just like the performing arts industry in New York about what are the expectations of what somebody should look like, or, what are the expectations of performance, and, kind of easing into it. So I think all of those were pretty big themes. And I'm sure as we progress, because the pandemic is still here, I think there will be a lot of those similar themes that echo in the coming weeks and months as well.
Yeah, for sure. And I think since both of you sort of spoke to like dancers and performers, I know that among like in athletics and in performance and things like that, there's this like longstanding trend of people kind of pushing through their pain. And a lot of athletes and performers and dancers just kind of like martyr themselves for a game or for a show without really taking care of their bodies. And especially like Sneha, since you mentioned that things are like slowly opening back up, there's probably going to be, it's going to take more for people to warm up or to kind of get used to what their bodies were doing before. And so I'm curious, like for folks who do have this mindset of like, oh, it's okay, I'll just push through the pain, like how do you both work with that? And what are some of your tips in sort of supporting their own recovery and journey towards their wellness and own self-care?
Sneha, I'll let you take this first.
Sure. So I think that return to play, return to sport, return to stage has always been an issue, because athletes and performing artists have this very similar kind of, their body is their lifestyle and their work. And so it's very difficult to tell somebody, be on the sidelines, be a bench warmer, sit down, be at home. I mean, especially in like the football industry, and there's so many other industries where physical therapists and other healthcare professionals have taken such a close look, at like concussions and different things, and what really is a timeline, and what should the expectations be for a player to go back into play, or for an artist to go back onto stage. I think those themes have been out there for a long time, and I think that the pandemic has also highlighted them even more. And in my case, as a healthcare professional, my thing is always patient comes first. The art of the sport needs to understand that and be able to have pieces already in place in order to expect that and be able to accommodate to that. So obviously in the performing arts world, like here in Broadway, there's a lot of swings who know like different parts or things like that. And I know it comes with a lot of funding, because I mean, it all boils down to money, right? At the end of the day, everything boils down to, we need the person to go back on stage because we need them to perform, because we need to make the show happen, because we need to make money. So I think that funding is one of the most important things here when we're talking about return to stage or return to play. And as a PT, my thing is always, if you're not back, the rate of re-injury, and you can see this across studies, once you injure yourself, the rate of re-injury when you do the same mechanism over and over again, it can be so harmful. And that really creates long-lasting change for the rest of that person's career if that's not taken into consideration. So my take on it is allow for the proper resting period. There's too much evidence out there for like the basic injuries like ankle sprains and meniscus tears and other kind of basic injuries. There's a lot of evidence on timeline for recovery. Of course, there's so much subjectivity to it as well, but there is a process and there is a healing time. And so I think it's important for people who are kind of the puppeteers to respect that and understand that all of these people are doing their best. So that's my take.
I totally agree to what Sneha said. And instead of just repeating what she has said, what I would like to add is that there's definitely a mindset thing here too, right? We spoke about, as you mentioned, Aishwarya, that there is there's this feeling of martyrdom, or like, pushing yourself, pushing your body and still making it to stage and still doing what you're supposed to do. And instead of wearing it as a badge of honor, because some of this, as Sneha mentioned, can lead to like repeated injuries. And sometimes, the more chronic an injury goes, or the more times you have an injury, it's hard to recover from it. And also, there are certain people who are prone to like more chronicity based on the past issues they've had or the structure of their body is. So it's important to, first of all, change the mindset and only get back when you feel completely ready. And as Sneha mentioned, there are a lot of protocols that we have, and this can kind of change person to person. But understanding that, you have to break down what you're doing into separate like parts. For example, if somebody wants to get back into running, you should be able to walk without pain. You should be able to jog without pain, and only that you can run without pain, right? And sometimes I feel that people go back into complex activities without being totally confident or strong in doing the individual components that are needed. So again, working with your rehab therapist and telling them exactly what your goal is, and also then the rehab person kind of working with you closely, understanding what are your specific weakness or flexibility issues, also working through your mindset stuff, changing that so that you're getting back to stage or getting back to whatever you're doing, sport or work, being stronger than before. And I talk to my patients about resilience. And sometimes, we talk about mental resilience and physical resilience, but how to build that? Because I feel that sometimes we just say that, oh, I'm getting old, or oh, this is what will happen if I'm a dancer. And that's not really the case. So understanding that, okay, what are some of the basic core conditioning work or stabilization work that you need to do on an ongoing basis so that you're keeping your body strong enough, even as you age, even as you go through different changes that your body puts you, or life puts you through, you're still able to recover from all of that and continue to pursue your passion or career without taking a lot of breaks.
Yeah, no, thank you both for speaking to that. And I love what you said, Divya, about mental resilience too. I think oftentimes I think more and more people are becoming aware of how much physical health and mental well-being are all connected. And it's like a holistic system that all works together. And so thinking about, the way that you both work with folks with any injury or anything that you see, how do you support people around the psychological aspects of healing, like with trusting their bodies again, right? Because obviously when someone goes through an injury, their body is not going to work the same way for a certain period of time while they're recovering. And so how do you work with your patients to kind of support them in working back up to trusting their body? I mean, I know speaking for myself, when I've been recovering from like ankle sprains and stuff, that's been a challenge too. So I'd love to hear how you deal with that.
Yeah, I think there's a science behind this, right? And getting people aware of the science so that they don't feel that it's like they are going crazy or they are overly anxious and they should not be feeling that way. So at one point, it was all about getting the structural healing to happen. Like if there's a vertebral fracture, once the fracture is healed, the person is like, okay to go back. But now it's becoming more about learning about pain sciences and understanding how your body and how your brain reacts to pain, and how different people with different experiences react to pain. Because pain is subjective. There's nothing we have to like concretely measure it, right? It's almost like asking somebody like, how do you rate your pain? Describe your pain. And that can be different for everybody. And so, again, understanding that there are these fear avoidance beliefs. Some people are, more apprehensive after an injury. Some people are like overzealous and do more than they can take. And then really understanding the person who is with you, not just a diagnosis. I'm not treating a shoulder rotator cuff strain, but I'm treating a new mom who needs to carry their child, and I cannot tell her not to do it because who else will? Understanding that, okay, I have to give this person other ways to kind of still do their function without hurting themselves, and then setting expectations right. Like today, I had a person while I was doing a virtual visit telling me that, she has frozen shoulder, and how long will this take to get better? And we know that frozen shoulder can take anywhere from a year to 2 years to get better. So setting expectations right so that people don't feel demotivated and don't feel like, oh, this is never going to get better. We have to keep that, the emotional well-being in mind, and make sure that a person feels upbeat about their rehab and they are getting better. But I also tell people that, there is that in people with chronic pain, the way the brain identifies the pain kind of gets a little muddled. So somebody who has had wrist pain in the first week or the second week of injury, they're able to pinpoint where their pain was. But if that pain has gone for over 3 months to 6 months, then it kind of becomes a little, they're like, okay, this whole thing hurts, or my whole hand hurts. And that doesn't mean that the pain is spreading. It's just that the way the brain is recognizing it is different. And so again, explaining to them, and most people right now are pretty educated and wanting to know more about this. And so I think it's kind of becoming easier for me to explain this to my patients and for them to jump on board.
I love everything that you said, and I completely agree, especially what Divya mentioned about pain neuroscience. It's something that physical therapists have been looking into a lot more closely. A lot of our continuing education courses and the way that we approach patients about chronic pain, there's so much more evidence out there, and there's so much kind of like better language that we can use when we communicate. So I think that Divya was spot on. I think primarily the way that you set expectations is by understanding your patient and setting the goals and the timelines for those goals in a way that makes sense. And it's not always just a, hard and fast rule. Like I have two patients, one mom whose goal is to get out of bed pain-free, and then the other one wants to run the New York City Marathon in 6 months, right? And those are not good or bad goals. It's just different. And so understanding what that person wants to do, that's primary. And if it comes to the stage, what are the type of movements that they need to achieve to create that dance performance, or whatever movement that they're doing? What are the kinds of movements that are required? And that's what physical therapists do, is we're movement experts. We look at that person, we look at the movements that are expected or required of them, and or the movements that they wish to be able to achieve through their own personal goals. And then we create a customized treatment plan for that based off of that. And we communicate that through language in a way that's effective for them, ideally, so that they can be on board. And we are working as a team to get them back. And if there's a teacher or a coach or somebody else that's involved, I try to get them on board too. So they are a big part of the puzzle piece, and they need to understand, they can't create a pressure or a counterforce that's inhibiting recovery and rehab. So I guess that's the other piece that I would add to it. But I completely agree that, timelines and expectations need to be set, and the patient really just needs to understand where they stand right now and know what the steps are to reach that. And we have so many objective measures as physical therapists to help them understand that they are getting better or regressing or progressing. We have tons of standardized tools that help us and them understand that. So we use that every session to reassess, re-understand, and move them forward.
Great. Yeah, thanks for speaking to that. I think that's this is sort of one of the, I guess, less talked about aspects of physical healing and recovery. So I was, I'm glad we were able to talk about that a little bit. I also wanted to just hear from both of you a little bit about, and I think our viewers and listeners would really appreciate too, hearing a little bit about your own journeys with and personal relationships with like healing or recovering from injury, and maybe some of the like body mind connections that you've noticed in that process for yourself.
Yeah. So interestingly, I'm a Bharatanatyam dancer. Aishu and I know each other because our parents are both Bharatanatyam, our moms are both Bharatanatyam dancers. And so as dance teachers' daughters, we obviously just like kind of grew up dancing in different capacities with each other. So we, and in Indian classical dance, it's very structured. There's a very, particular format. You do this, you move on to the next step. You do this, you move on to the next step. You do your Arange trim, you perform. And so, and of course we did warm-ups. We didn't really focus too much on cool downs in class as much, but in general, it was always emphasized to practice year round, not just for a performance. And I think that was a really important thing that I learned as a child, to continue your practice, not just because you have a performance coming up, but that it's a regular practice. And I think that, understanding of consistency goes across in everything that I teach to my patients. We can't be weekend warriors. We can't, when you increase your load, a lot of studies show that like 2 weeks after, when you suddenly increase your load, you have more of a rate of injury, right? So there's lots of different studies that show that consistency is really important. But I'll tell you my personal story is I actually have a stress fracture in my back, L5, S1, and this happened when I was in physical therapy school, actually. And I really, for my own understanding and understanding my biomechanics, I get why that happened. My hip flexors are really tight. I move from my spine. I don't do a lot of hip extension. And so over time, I ended up having like an acute episode where I was like bedridden for a long time. And I remember getting a phone call from the doctor, who actually I interviewed on my podcast just a couple of weeks ago. And he said to me, here's what it is. This is what you, and up till then, I've never been like actually injured to the point where I'm incapacitated. Like I can't move. Like, sure, I hurt myself here and there, but it's usually not a big deal. It doesn't prevent me from it. I get right back up. So he said, here are the things that you need to do. You need to go to PT. Obviously, you're in PT school. You understand this, but you also need to do activity modifications. And he started listing them. And I was like, I started crying. I was like, no. And one of the things he said is, you need to understand that a lot of high impact activity can be harmful, and a lot of extension based activity can be harmful if you do them to extents that are not right for your body. And basically what that means is with the type of stress fracture I have, if I bend backwards, and for example, like I'm also a yoga teacher, so I do tons of wheel poses, and I did ballet growing up. I did arabesques all the time, and in dance and classical dance as well, Bharatanatyam, there's a lot of extension-based work where you bend backwards. And so he's like, you need to understand your body's limits for that. And so at that time, this was now years ago, it was very difficult for me to process that, even being in physical therapy school and even understanding the mechanics of it. But I think having gone through that, I understand back pain so much. And I think that I have like this extra empathy for people who do have back pain with my patients. And I understand how to approach that in a way that they can understand, because having gone through it, I still have to do my exercises forever. I still manage my pain. I still do my regimen. I have the things that I do, this very specific stretches for my body every morning. And I know when I'm slipping off, get right back on it. And so this is how I communicate to my patients. And I think, even though that felt like the worst thing in the world, I'm actually really happy that I went through that and still have that as a part of who I am, because I don't think that I would be able to treat my patients as effectively without it. But yeah, that's kind of like my personal journey. And I think that anybody who's in a patient facing role, if they can have more empathy and understand what that patient is feeling, and even to like a small capacity, I think that just empowers you and creates so much more, patient provider rapport that enhances our well-being and enhances rehab, because we also know a lot of treatment outcomes is directly correlated to your affiliation and your understanding and your rapport with your provider. So I think that that's such a key component that a lot of people who treat need to understand and reflect on a little more too.
Thanks for sharing your journey, Sneha. I think a lot of rehab professionals actually have this common theme of going through an injury themselves, and probably, having good a relationship with their PT or OT at that time, and wanting to know more about the profession, or that sparking an interest in the field of physical health. And so so to share my journey, I dislocated my kneecap when I was in like 11th grade. And at that time, I'd already done my Arangetram. I'm a Bharatanatyam dancer as well. And I was doing my post-graduation. And I had this injury. And like Sneha mentioned, it was my first big injury. And I feel that I did not give much attention to rehab at that point. I just wanted to get back into dancing. I was like, I just want to do that. I don't want to just do some knee extensions and just some stretching. That sounds too basic. And I want to get back to dancing, those complex movements. And although my orthopedist at that time told me that, no, you have to make sure that you go to a PT and you do these, take at least 3 months and slowly build up your strength. I was like, whatever, let me just do what I want to do. And I could feel that at that time also my knee would get swollen every time I would push it. And then I started, wearing a knee brace, and I would tape my knee. I would say, I would not do some of those movements which requires full squatting fully, because I know that, my knee can't take it. So I started doing these little modifications and preparations before each dance performance, to a stage a year later where I could not do even the basic steps. And at that time, I went to meet this really famous orthopedist who used to treat cricketers. And I went to a different state just to meet him. It was like a 6-month-long wait to see him. And I went to see him. He said, you should stop dancing, otherwise you will lose your leg. I still remember his words. And I was like, what? People come to you because you would not say this. And I told him that, if a cricketer came to you, would you give them the same answer? And he said, their livelihood depends on it. They make millions out of it. You are studying to be a PT. Dance is just a passion. You can take a different dance form if you want. And at that time, I felt so cheated. I felt that, I had identified myself more as a dancer than anything else, right? And so I want to give that up. I want to make sure that I'm able to do that. So even in my DPT, when I was doing my Doctor of PT, I did my dissertation on the knee pain, the patellofemoral knee pain that I had. And I got to learn a lot about it. And that's why when I then, I worked for Google for 6 years, I worked in a hospital. And then when I decided to start my own practice, I wanted to treat dancers who have gone through a similar knee pain, because I had already done my research on it. And as Sneha mentioned, I felt more empathy towards them. I felt that I've been through that journey, so I can guide them better. And then I realized that I was not the only one. There were so many dancers. And this, I think, is more specific for the performing arts community, not the athletic community, because I feel for athletes, there is still like more access to resources, right? There are people who know the sport. There are like athletic trainers, there are specific strength and conditioning coaches, there are like coaches who help you like perfect what you need to do. But in terms of dance and music, I feel that there's just your dance teacher and you just go to them if you have any issues. And of course the dance teachers are good at what they do, but they're not healthcare professionals, and sometimes they struggle on who to send them to, because if they send them to the ortho, the kind of person I went to, they will just dissuade them from like following their art form. So I think that that journey really made me understand that, okay, there are certain things where even the best of the professionals might not be able to really understand your journey and what you're going through and guide you in the right way. So you'll have to take up on your own hands and do your own research and figure out what's going on. Now, not everybody will become a PT, but reading up on it, making sure that you understand your anatomy and physiology definitely helps. I tell my patients that whenever I'm when they come in for the evaluation and I'm explaining to them exactly what's going on, I tell them that, let me know if this is too much and too overwhelming, but I don't want you to just, see you and then prescribe you some exercises. I want to make sure that you understand what's going on so you can make the right decisions, which will then help you with healing, because you come and see me probably once a week or once every 2 weeks, but it's what you are living in that body for the rest of the time and what the decisions you make will be more meaningful. And this is the knowledge that you're building, which will also help you to not have re-injury and not having to come back to see me in future, right? You're discharged for good. You know what you need to do. You know the good do's and don'ts. So again, I think my journey really helped me make me a better PT, and I still kind of continuing to learn. And I feel that I'm able to kind of address the needs of a lot of performing arts community because I have gone through it myself.
Yeah, I think it's so amazing. Like both of you mentioned, obviously your experiences have kind of made you have more empathy for your patients, but also one thing I really appreciate is that both of you are really empowering your patients, right? Because I think often in healthcare systems, there's this hierarchy, right? Like whatever the doctor says is like God's word. I have to follow what they're saying. But I think really, especially in this day and age, taking into account, like we were talking about earlier, what the patient's goals are and where they want to go in terms of their own healing and recovery journey is just as important, so that you know also how to support them in that process. So one thing that I think, Sneha, you had talked about earlier in your story about just having that consistent practice. I wanted us to kind of touch on that a little bit for our experiential activity, which is, I'm calling it stretch share sequence, but basically it's, I want to invite us to kind of share some stretches that we do on a regular basis that kind of keep our bodies healthy and in check, and yeah, just kind of how we take care of our own bodies and selves. So yeah, I guess each of us can start by sharing one or two, and then I would love if we could like put it together into like a sequence that we can repeat that, might be helpful for folks who are watching as well, in case they wanted to follow along. How does that sound?
Yes, I think that sounds good. I can start. I'm doing a lot of like these desk stretch sessions these days, because I feel that people are like super busy and then they are, glued to their desk for most of the day. Asking them to take out 30 minutes and, go to the gym or step outside or even like get onto the floor or, grab some equipment makes it harder. You're putting more roadblocks. So I'm showing people how they can easily do it with no equipment while sitting or standing. So I'm happy to kind of share a couple of stretches that I myself follow as well. I can show you a good stretch for the upper body, and I can show you a stretch for the lower body. So, making both the parts of the body happy. So for the upper body, one of the stretches that I really like is a stretch for the muscle in the side of the neck. So you just take your right hand, you place it on the behind your low back. You take your left hand and you place it on the side of your head. Your fingertips should be touching your ears. And then without shrugging your shoulder, you go ahead and side bend your head to the left side. Make sure it's just your neck that's feeling the stretch and your head that's moving. You're not moving your torso. You keep your gaze forward and you hold this stretch at least for 15 seconds. You breathe and relax the rest of the body. So belly breathing, which is diaphragmatic breathing. Slowly come out of that position. Let's do the same thing on the other side. Left hand behind your low back, right hand on the side of your head. Don't pull too hard. Just slow and gentle. You're looking for a 6 out of 10 stretch discomfort. So too much, like a 9 out of 10 is too intense, risk of injury. Too less, like a 2 or 3 out of 10 might not be very effective. After a few seconds, if you feel your muscle is getting looser and you're not feeling as much of a stretch, you can go further into the stretch. And then relax. Now for the lower body, a stretch that I really like is the hip flexor stretch. So hopefully you all can see me. I go over here. You need an elevated kind of surface to do it. So you can either use your chair or an ottoman or a step or anything else. And I usually tell people to take their right foot, place it on the step, get your hands on your waist. You do a pelvic tuck, like tuck in. And then you lunge forward like this to feel a stretch in your hip flexor. So let me repeat that. Take your right foot, place it on the step, do a pelvic tuck to get your back flat, and then lunge forward to feel a stretch in your groin muscle on the left side, or the hip flexor. Now raise the same arm up, left arm up, and then side bend to the right side. This is a great stretch for people who sit for a long time, even for dancers who usually tend to have hyperextension in their low back. And you hold the lower body stretches for at least 30 seconds because these muscles are bigger and longer and you are overworked. Come out of that position. Let's do the same thing on the other side. Foot on the step, hands on the waist, do a pelvic tuck, lunge forward till you feel a stretch in your hip flexor muscles, and then raise arm on the same side of the leg that you're trying to stretch, and then gently side bend towards the other side. Keep looking straight forward. Keep your torso upright because only then you will feel a good stretch. Keep the back flat so you're not feeling any strain in your low back. For all the stretches, you have to do relaxed breathing so your entire body stays relaxed. And then come out of the position. And these stretches for the neck and the hip flexor can be done multiple times a day. But if you do it at the beginning of work and at the end of the work, it'll be great. You'll feel really good and your neck and hips won't feel like they're tightening up.
Amazing. One of mine was going to be a hip flexor stretch too. I do it a little bit differently on the floor, but we'll skip that one. Two exercises or two stretches that I really like. One is actually the eagle pose in yoga. That's just for upper body. So what you do is you hook your elbow into the other one. Doesn't matter which one you do. I usually kind of interlace my fingers like this. And then what I do is I pull my elbows forward and up gently until I feel a stretch that's kind of in between my shoulder blades or my upper back. If you want, you can also look down to intensify the stretch a little bit more. You don't have to, but it does get your lower cervical spine a bit more as well. And the idea is that you're really just stretching out this area that's in between your shoulder blades and your upper back. And you can hold a stretch for 30 seconds or so, and then you flip. So whatever side that you put inside, you go the other way, flip, pull your elbows forward and up slightly, and then you can look down, your choice. That just intensifies the stretch a little bit more. And then you just pull that stretch in between. You should feel it kind of like slightly differently from side to side. It might even feel like one side of the stretch is more intense, depending on which side is actually tighter on your body. And then you hold each side for about 30 seconds and then relax. And then the other one that's a little bit more, I guess, a full body stretch is a one-legged downward dog that I like to do with an ankle lift and circulation. So I'll show you guys that one. Just need a little bit more space for it. And let's see if I can go like that so you can see the whole thing. But you get into this downward dog just like you would typically. And the idea is that you're bringing your feet as close to the ground as possible with your hips as high in the air as you can. You try to kind of keep your back as flat as possible as well. Once you get here, you bring one leg up and then you circle the ankle at the top. So you're kind of just making little rotations with your ankle. I don't think you can catch my ankle in this, but I'm just going like this with the ankle that's up in the air. And then you reverse it and you go the other way. And then you just maybe do about 10 circles on either side. And then you drop the leg and then you do the other leg, just like Divya's doing, just like Aishu's doing. You hold the leg up and then you do little circles. It's a good stability exercise for your shoulders. And at the same time, you're stretching, you know, whatever leg is down, you're stretching the whole backside of that leg. And the side that's up, you're kind of using that to stabilize and rotating your ankle. So I do this one pretty much like every morning. I really like it. But if you guys like, you can give it a try.
It felt great. Thanks, Sneha.
Yeah, thank you both so much. I feel like I got my stretching in for the day and it felt really nice, and highly recommend to all the viewers, follow along if you can in your respective spaces. So thank you both for sharing that. That brings us to the end of our episode, but you know, once again, I wanted to thank you both so much for being here on Tri-Side Chats, and it's been, I think, really, really helpful, hopefully information that people will find just about healing and recovery and how they can take care of themselves. So thank you so much for being here.
My pleasure.
Thank you. Thank you so much for having us.
Hello viewers, I hope you enjoyed this episode of Tri-Side Chats with Divya and Sneha, as well as our stretch sequence at the end. Please do like, share, and subscribe to the Creativity Awakening YouTube channel for regular updates on our videos. If you'd like to get more exclusive sneak peeks into our episodes and the creative process here at Tri-Side Chats, you can follow our social media pages that are linked in the description below. Stay tuned, the next episode for Tri-Side Chats is premiering soon.